Welcome back. It's Blue September, the month dedicated to raising awareness of prostate health. And with 3,550 Irish men diagnosed with the disease every year, the Mary Keating Foundation's Stand Up for Your Prostate campaign is looking to empower men to be more open and comfortable discussing their health.
Now, they're urging men to watch, talk and act. That's watch for any symptoms, talk with family and friends and act by going to see your GP. And joining us this morning, our consultant urologist, Mr. Aaron Thomas, and Dave Mahidi, who survived prostate cancer.
Good morning,
to you both, gentlemen. Thanks for joining us.
How are you?
David, you're a dub living in Limerick. You're wearing the blue today, which we like to see.
And it's Blue September.
Blue September,
All the signs are good.
All the signs are good. And indeed for you, all the signs are good. Tell us first how you came across your diagnosis. You were seeing your doctor regularly for other issues, so in that case, somewhat of a stroke of luck.
Yeah, no, in fact, I was very lucky because I suffer from gout, which means that you need medication on a regular basis. So every 6 months to a year, you got your blood tests. And bit by bit, over the last 4 or 5 years, my PSA has been rising. I remember the last time I was with the GP, he showed me the graph and it was there just rising. Yeah. Said, I think we'll have to have a look at this. And I think that was a help because it caught it early. Whereas my best friend Tony Ward, who also had has had prostate cancer, hadn't been to a doctor for 4 or 5 years, and we'd been in regular contact over that period, and it was hard for him because it had advanced that bit further. So I kind of learned from his diagnosis to keep an eye on things and make sure you do something about it.
So when you were diagnosed, then Dave, there's a treatment plan set out straight away.
Yeah, well, what they do is they send you for an MRI and then a biopsy to see, where it is and at what stage it's at. Now, because it was early, which in my case was great, it was contained within the prostate, which meant then the treatment was, let's take out the prostate and be finished with it. And thank God, and touch wood, that worked, and there's no sign of anything in the bloods now. But the trouble with it is sometimes it goes beyond the prostate and creeps into other areas, and that's when you're in bigger trouble. So the message is to get it early. And I suppose because of where it is and we don't talk about it much and we kind of push that to the side. And the other thing was I had no symptoms whatsoever, and I know you'll be talking symptoms soon, but I had none whatsoever, nothing to say.
But you were lucky enough that it was flagged up through this constant blood test and your levels were creeping up.
But you see, I thought that, in my profession, you're training every day, you're working out.
Tell us a bit about what you do.
Well, I'm director of sport at the University of Limerick, so I get to do my hobby every day of the week and get paid for it. But you're active and physical education would be my background. That's where I came from. But
and what was the period of time from the initial diagnosis to having the surgery, which was only this year?
Yeah, it was in January I had the surgery. It was diagnosed in October, but it was creeping up over the last couple of years. Bit by bit, the numbers, there's a number on it and was going 3s, 4s, 5s, 6s, 7s and rising. So diagnosed fully after the biopsy in October, and I had the operation in January. I was back working within 3 or 4 weeks.
And all good now, touch wood.
All good, touch wood, yeah.
Aaron, we mentioned in the intro there, those figures are startling. Over 3,500 men diagnosed with it every year in Ireland.
That's right. So there are a lot of men per year in Ireland that are diagnosed with prostate cancer. Thankfully, for the majority of those men, when prostate cancer is found, it's contained within the prostate gland. And so for men that need treatment, it's extremely treatable and the survival rates are excellent.
So let's talk about symptoms then. What are the flags that we should be looking out for?
So as Dave said, a lot of men have no symptoms, and it's usually after having a conversation with their GP that they get a blood test and an examination, and that leads to further investigations. Other men may have urinary symptoms, so going to the toilet more frequently, getting up at night more than they should. There may be a whole number of urinary symptoms. Often they're not related to prostate cancer, but rather they're an aging process, and the prostate tends to enlarge with age, and that's a completely different
And might that
process.
often be the case with men going, well, I'm just getting that bit older, and that's the reason I'm up 2 or 3 times a night, and nothing more serious than that?
Exactly, and part of the campaign is to encourage men to discuss these issues, not only amongst themselves, but with their GP, and then make a decision of whether it's relevant for them to get tested or treated.
And what form does the test take then?
For prostate cancer, the test is a PSA blood test and an examination of the prostate gland. And that's, they're two simple and straightforward tests. If there's concern with those tests, then a GP or a urologist may then recommend, like you had, Dave, an MRI scan of the prostate gland and or a biopsy as well.
And the key message is that if you get it early, there are treatments available.
Absolutely. So there are different kinds of prostate cancer. Some cancers don't need treatment, and other cancers, like we've already mentioned, the majority of cancers are found early, and when that's the case, they're very treatable. So,
do you think we're getting better as men, or are we getting worse about having conversations around things like this?
I think we're slowly getting better, but there's still a lot to be done, and I think there's still a lot of encouragement that needs to be done as men to be able to be open and discuss these issues, particularly around things like the prostate, which, as you said, aren't really discussed.
What do you
very
think,
openly.
Dave? Same question. Do you think we're still very bad at it?
No,
as men?
I think we're bad at it in that. I went for a game of golf a few weeks ago, and one of the people had the operation, but nobody knew anything about it. It wasn't until we kind of halfway round were in the bathroom kind of for a break, and one of the other fellas was slagging me, you know, that it was taking so long.
Yeah.
And your man says, what's wrong? And I said, well, I've had my prostate removed. He says, oh, I have too, but I haven't told anyone, you know.
Really?
And he says,
Even
don't say
after
anything.
the surgery?
Yeah, I haven't told anyone. And I said, I know, and it's probably because, you know, as men, we don't like to talk about that, and, you know, you're talking about an area of our manhood and everything like that. So,
Is there a
you know,
fear to it, though, as well? Is it?
There is, although the funny thing is, the amount of people that said, you know, if I said to them I got prostate cancer, oh, that's the one to get, you know, that's the one to get.
Yeah,
That is the line you hear.
That is the line
And I
you
said,
hear,
well, I
yeah.
prefer not to get anything.
Yeah,
Sure, you know,
absolutely.
but,
And I don't know if that reassures
yeah,
people, but
but
doctor,
that's-
if you can
yeah.
reassure people that the survival rates of all types of cancer, particularly men's cancers, in prostate cancer is exceptionally high.
Absolutely, and when you treat prostate cancer early, the survival rates are well over 90% into the long run. So it's you know, for a lot of men, it's a good news story at the end of the day.
That's the one to get, is it?
That's not what the doctors. That's what the lads in the golf club say. Is there an age, or should all men be aware of this, or is there a particular age where you really need to go to your doctor and just to be checked whether you have symptoms or not?
So I think if you have a strong family history of prostate cancer, so if there's 1 or 2 or more individuals, close members of the family that have prostate cancer, then that increases your risk. And in those men, it is certainly worth having a discussion with your GP about considering getting tested.
I remember years ago going to get a full medical check. For no particular reason, I just went and got a full medical check. And I remember the doctor saying to me, the consultant saying to me at the time, that as a rule of thumb, that men should be getting a general health check once a year, up to the age of 50, and then once you turn 50, you should be looking at getting a general medical check twice a year. Would that be a good rule of thumb?
Well, I think getting checked regularly is a good thing in terms of your general health, and as part of that, you can at least have a conversation of different aspects of that, including sort of prostate health and whether or not it's appropriate for you to be tested for prostate cancer.
And in your case, Dave, and in all men who've had prostate cancer and had the surgery, is there follow-up appointments needed, care needed?
Yes, there is. Like you have the operation done, and about 3 months after that, then you're checked again, and your bloods are checked, and there's a chance that there's still remnants of it. So another 3 months, then you're checked again, and really after that, you can relax that bit more. So it's 3 months for the first year, and then hopefully they'll want to see you again.
You're flying it.
I'm flying it.
You're off
How's
to
the
Thank
golf?
God.
How's the golf?
Very poor.
Still bad.
Still bad.
Well, I know you're off to Croke Park this evening.
And off the Croke Park this evening.
Enjoy
yeah.
it. Listen, we
Yeah.
appreciate your time.
Yeah.
Thank you for coming
No,
and telling
thank
your
you.
story, Dr. Aaron.
Thank you very
very
much,
much.
yeah.
Thank you, lads.
Now, for more information on the Marie Keating Foundation, Stand Up for Your Prostate campaign, just if you want to get your hands on the charity pin, the website details are on the screen now.